My name's Anne Hollis and I'm Senior Workforce Development Practitioner for Adult Social Care in Trafford Council. You do need a good degree to be a social worker, but you can start off just basically getting some experience in social care. So for myself, I started at the age of 19, not knowing what I wanted to do. And I got a job as a care worker, working with adults with learning disabilities. And I also worked as a volunteer for Women's Aid, which is an organisation supporting people who are experiencing domestic violence. And that gave me the experience to then make an application to do the degree. The tools of the trade are the tools that you have as a person. So it's your ability to communicate with people. That is the strongest tool that you have, the ability to connect with people, and sometimes you have to do that really quickly, to try and gain people's trust so that you can work together to support them with whatever issue they've got at the time. So that is the main one. But in terms of technology, we do use technology in that we have to record everything that we do, the information that we gather, so that is uploaded digitally, but we also use the internet for online learning resources to develop our skills and knowledge. I think you have to be interested in people, and you have to have a caring nature and a recognition that there's lots of people who, for whatever reason in their life, they're experiencing a lot of difficulties, and they need that extra support. And it's important for you to support someone in a non-judgmental way, so that you can develop a rapport with them as quickly as possible, and to be a good listener, to listen to what people have to say, because often they have the solutions. You're just there to support them to find them. So greatest success, there's a few really, but I think one of the situations that I've never forgotten was supporting an elderly lady who'd lived in a nursing home for a number of years, and I supported her to return home to her husband after they'd been apart for so long, and it involved arranging some services to support both of them, but to be part of that and the effect that it had on their lives was wonderful. I think that's all about learning. So one of the things that I've learned over the years is that you can never give up on people. It's never too late for change. And I remember working with an older woman who had had an alcohol dependency for many years and had been involved in our service on and off throughout her life. Many attempts to give up alcohol, and she gave up alcohol in her 80s for good. And so that is what I take when I get involved with people, is to think, you know what, you never know. I think that as I've said before, I think if you are a caring person, you are interested in people, you can see that people don't always have the easiest of lives, and you want to support people, that it may well be the career for you to be a social worker, and you don't necessarily have to come into adult social care with lots of qualifications. It's very much about the person that you are, the qualities that you have. So if you feel that you haven't done as well as you wanted to in your GCSEs, you can consider going into care work and doing qualifications or an apprenticeship, and that can actually progress you through your career through into social work.